Greetings. Today's topic is on mask wearing in public places and school policies on mask wearing. There have been major changes. This week in Rhode Island, there have been some big changes taking place related to COVID-19. Governor McKee, as of February 9th, 2022, signed an executive order informing the public that mask wearing in public places will be dropped and no longer required, and that the school policies of mask wearing will be changed. Those are big changes for many of us here in the state of Rhode Island. Why all of a sudden are we having these changes and it didn't happen earlier? Well, the governor, along with the Rhode Island Board of Health, have been following the numbers and looking at the statistics since they have been driven. So for the last 30 days, the numbers have plummeted. So what I would like to do is to share the numbers with you on the graph that we need to be mindful of. These three key factors. If you notice the first factor, the second factor, and the third factor. These three factors show the new positivity rate of transmission, new cases. Now, previously, as of January 8th, there were 3,504 new cases per day. But as of February the 10th, that number has plummeted to 367 positivity cases. That is a 90% decrease. Now, when we talk about the positivity rate in terms of transmission, and at the rate that it transmits to other people, as of January 8th, it was 21.1%. But as of February the 10th, that number has also plummeted to 3.9%. And the last factor is the hospitalization rate in terms of bed facilities. Now, Rhode Island has had a limited space for beds. Previously, as of January 8th, there were 584 hospitalizations. But as of February the 10th, that number has also dropped to 227. That is about a 61% decrease. So these are significant decreases that have led to this decision for Governor McKee with the Rhode Island Department of Health to go ahead and make these changes. It seems that the Omicron variant is now dissipating at a fast rate considering that it just came up on the scene in November and December. So it had different characteristics as its former predecessor of the Alpha and the Delta. The Omicron variant also has not contributed to a lot of deaths. So those numbers have been very small as well when it comes to deaths. So the state and the governor feel very comfortable in proceeding with these changes. Now, I'd like to explain a little bit in detail about these changes. Now, pertaining to face mask wearing, it doesn't mean that everyone does not have to wear a mask. Instead, it means it only applies to those who are fully vaccinated, meaning you've either had one or two of your shots in full, such as the Johnson & Johnson 1 shot with a booster and the 2 of your shots from Pfizer and Moderna with your booster in public places. So if you're going to like a sporting event or a theater or a hospitality facility, a restaurant, or shopping at a mall, or places of service, car repair shops, you're no longer required to wear a mask for indoor environments, which does not go into effect until February the 11th. Now, for those who have not been fully vaccinated or are only partially vaccinated, they must still continue to wear a face mask in all indoor settings because of the fact that they have a high transmission rate and they have the very low vaccine rate. So the Department of Health is asking those who are in that category to please go join the rest of us to get your vaccination and your booster. Also, in most restaurant settings or any places where you have less than 250 people, they used to formally require you to give proof of vaccination. That will no longer be required. So you don't have to carry that proof of vaccination with you. However, there are some settings in where you will still be required to wear a face mask. And those are in 3 different categories. One is hospital settings, healthcare settings, nursing homes, or any medical providers facilities that provide medical treatment. So they want to ensure that they have, a very good, clean environment. So they would still be requiring face masks. The second category is places of transportation, such as airports, bus stations, train stations, where people congregate inside these facilities and then board on planes, trains, and buses. They will be required to wear a mask. Now, some places will be required to still show proof of vaccination, such as the airlines. And for those people who are immune compromised, that they've had their vaccinations, they still need to wear their mask because their immune system is compromised. So they will be treated just as those who have not had their vaccinations, okay? And also the possibility of them transmitting the Omicron variant to other people. So in total, the government is basically asking people that it is now time for people to take responsibility for themselves. So for the last 2 years, government has been making decisions and guidelines and policies. Now they are thinking about empowering the people to make their own decisions, to make a moral decision. Now, pertaining to the school system from K to 12, mask wearing policy will stay in effect for the time being from February 11th to 2022 until March 4th of 2022. Then beginning March 4th of 2022, each local district with parental input will be making their own decisions whether the school systems were using masks and staff and so forth, and administrators. Okay, so that will be left up to the local district of each school. No longer will the Board of Health or the Board of Education be making these decisions. It is now upon the school districts, because each school district in each town, their percent of positivity rate and so forth are different from each other. Some are high and some are low. So therefore they can all not be treated the same. So the decision-making will be transferred to the local facilities to make their own decisions. The Department of Health also explained that when you look at, this pandemic that we've had for COVID, this is no longer considered a pandemic, but has now been downgraded to an endemic, meaning that this is now considered in the same common flu category. Many diseases in the past have been downgraded to certain facilities or labeling because of the fact that now we have vaccinations, we have boosters, we have treatment, IVs, medication, and just recently, we now have oral medication that can also help with COVID to prevent that. So these are treated like the common cold, measles, mumps, and so forth. So it's treatable and preventable. So now this is basically a decision that we can all enjoy. Now, with the news from the governor that was just announced this week, I want one thing that all of us need to be aware of. At the federal level, the CDC, their guidelines pertaining to face masking still remain in effect, and they have not changed for indoor environments. And that is because the CDC is really focused on one number only, which is a standard that they apply to any disease, and that is community transmission rate. So I would like to share the reasoning why where we stand in the state of Rhode Island, okay, as of February the 10th. So if you look at this chart behind me, you will see the numbers there. As of February 10th, Rhode Island's community transmission rate is 367. When the CDC sees that number, that is considered high. That's why it's labeled in red. Anything above 100 is considered high. The CDC rate is 100 or less than 100 per 100,000 per day. So on a daily testing, say 5,000 or 10,000, it has to be less than 100 positivity rate per day, which is considered very low by CDC matrix. So right now, 367 is considered very high, but he is leaving it up to the states to make your own decisions if you want to take those mandates down or not. That is a state decision. So I want you to be mindful of that. So keep an eye on the CDC in terms of what they advise and what they recommend. I will be keeping you informed about what these numbers are, and as they get lower, we will share that information. So we will, see what's going to happen at the next announcement. One more thing I would like to bring to your attention is that we've just passed our major holidays, but we have two more major events taking place right now. And that is February 13th, we have the Super Bowl Sunday, and currently we have the Olympics going on, where there are large gatherings, people are having parties, a time for people to, enjoy each other, which is fine and good. However, keep in mind that if you have any symptoms, such as a cough, sense of loss of smell or taste, do not bring your symptoms to a party. Stay home, play it safe, because the Department of Health doesn't want you to go to a party and then have the spike go up and start bringing your symptoms to cause a spread of transmission of this disease. So please stay home. You have a TV, you have a computer, you have social media, you can actually enjoy these events. You don't need to go in person. So please be considerate of others and do not join your friends in parties until you feel better. And get vaccinated, okay? And remain safe by wearing your mask. Thank you.